If you're approaching that magic age of 65, it's time for you to sign up for Medicare. There's a lot to know, but the very first step is understanding the 4 enrollment periods. If you miss enrollment deadlines, you could be penalized for the rest of your life. You are first eligible to enroll in Medicare when you turn 65. You enroll during your initial enrollment period. The IEP is 7 months long. 3 months before you turn 65, the month you turn 65, and 3 months after the month you turn 65. If you enroll during the 3 months before your 65th birthday, coverage begins the first day of the month you turn 65. Enrolling any other time during the 7-month window pushes out the beginning of coverage. You need to decide ahead of time whether you'll enroll in Part A and Part B Medicare, known as Original Medicare, if you'll enroll in Part D prescription drug coverage, or whether you'll choose a Part C Medicare Advantage plan, which includes Part A, B, and D, and possibly dental, vision, and hearing coverage, depending on the type of plan. If you or your spouse continue working past age 65, and if you'll be covered by an employer group health insurance plan, you can delay enrolling in Medicare without penalty until the employer coverage ends. That's when you get a special enrollment period. The SEP lasts up to 8 months after you retire or lose your employer coverage, whichever comes first. But with an 8-month window to sign up for Parts A and B, you have no primary health coverage until Medicare enrollment is complete. Even COBRA coverage is secondary to Medicare. Medicare A and B covers 80% of costs, leaving COBRA to pay 20%. So for the period you do not have Medicare Parts A and B, you have to pay 80% of your medical costs until your Medicare coverage kicks in. You can enroll in Medicare 3 months before your employer coverage ends, so it's a good idea to enroll as soon as you can. If you're still working at 65 but do not have access to employer group health insurance, which is defined as a company plan for 20 employees or more, you must enroll in Medicare at age 65 or be strapped with late enrollment penalties for the rest of your life. The penalty is 10% for every year you were eligible to enroll in Medicare, but you didn't. There's also a separate delayed enrollment penalty of 12% per year for Medicare Part D prescription drug plans if you don't enroll by the deadline. If you miss your initial enrollment period or special enrollment period, you get another opportunity to enroll during the general enrollment period. That happens every year, January 1st through March 31st. You can sign up for Parts A and B, and your coverage begins July 1st of that same year. The final enrollment period is open enrollment, October 15th through December 7th every year. Open enrollment is the time you get to make changes to your coverage. You can switch from Original Medicare to a Medicare Advantage plan, change Medicare Advantage plans, switch from a Medicare Advantage plan back to Original Medicare, or you can join, drop, or switch Part D prescription drug plans. New coverage begins January 1st of the following year. Best advice? Take the initiative. Make sure you start early enough to do your research and understand all your options, and don't be afraid to ask questions. Know the deadlines and make sure you hit them. Medicare could care less whether you sign up in time or not. The deadlines are written in stone, and if you miss a deadline, it's on you. There are no second chances, only penalties. More useful information is on the way, so subscribe to the Alhambra Investments channel.